So we're gonna start this session. So this session will have a short presentation from Maggie MacAulay and Skylar Wang, who works for the Resist Stigma project. They're our knowledge development coordinators. And after their presentation, we will have a very important panel to kind of think through what we've been talking about over the next 2 days and kind of try to discuss some of the next steps that we need to take on as a community to resist stigma. So I'll leave it to Maggie and Skylar to do their presentation.
Okay, great. Thanks very much. So my name is Maggie. I'm a PhD candidate in the School of Communication, and this is Skylar over here.
Yeah. Hi, guys. My name is Skylar. I study sociology at UBC.
All right. So Skylar and I are just going to show you some of the preliminary results we have from a scoping review that we're doing. It's part of formative research for the anti-stigma campaign geared at young gay men. And we won't have time to get into all the differences between like a systematic review and a scoping one, but I'll just say that one of the main differences between them is that in a systematic review, we tend to go more into depth, and a scoping review is more about breadth. So the main research questions that are guiding our review so far are, 1, what are the most effective and promising ways to reduce HIV stigma? 2, what works for reducing HIV stigma among young gay men? And 3, how can social media be used to reduce stigma? So as part of our scoping review, we looked at both peer-reviewed and gray literature. So things like journal articles for the first, and looking at white papers or reports that some of you have to write regularly for the second. And so to answer our research question, we looked for interventions, programs, and campaigns that addressed HIV stigma among various groups. Today we're going to be showing you examples of HIV stigma campaigns geared specifically at gay men. So we limited our sample to regions that were similar to Canada. So we picked the US, the UK, Australia, and parts of Western Europe. And we included content in both English and French as part of our search.
All right, so I'm just going to briefly run through some of the processes that we took to gather the sources. We started off by running a search of our keywords through several online databases, and I'm in charge of the peer-reviewed component. So there were 4 databases that I had to look at: PsycInfo, PubMed, Sociological Abstracts, and CNOW. As for Maggie, who spearheaded the gray literature search, she looked at an extensive range of online catalogs, Google search engines. So she looked at grayliterature.org, Policy Archive, Google Canada, Google Australia. You get the picture. So yeah, and as you can see on the screen, these are just some of the numbers that we're working with right now. All right, so we're framing our presentation using 6 general principles that have been proven to be successful in fighting stigma. And these strategies are adapted from the book Paradigms Lost, Fighting Stigma and the Lessons Learned. The book is written by 3 leading scholars in the field of psychiatry and health sciences. And I just want to stress that they focused mainly on mental health stigma, so it's not HIV stigma. And we know that there are a lot of differences and nuances between the two, but we just wanted to highlight some of the key principles because we felt that they're really relevant and germane to our research. So I'm going to briefly go through some of these concepts and principles. So number 1, put people first. This just means that people who suffer from stigma should be our priority, and they should be involved in all steps of planning an anti-stigma campaign. So they should be involved in the programming, the planning, the evaluations, and all that. Without information from real people and real experiences, we run the risk of misaligning our objectives with problems that may not really be truthful. So second of all, we have plan for sustainability. This just means that programs that fight against stigma need to take the long view. And we have to plan for sustainability from day 1. Program developers often are tempted to frame their campaigns based on the fact that because campaigns involve usually short bursts of activity, so that's not a very good way to frame your program. So we'll be talking about how to make it sustainable in the long run. Number 3, focus on activities that change behaviors. So considering improvements in changes in attitudes, values, or perceptions doesn't mean that that will lead to concrete behavioral changes. And we'll highlight some of those later as well. Number 4, target activities to well-defined groups, and that's pretty self-explanatory. In order to be successful in fighting stigma, you should cater targeted activities to a well-defined subpopulation. And number 5, think big, but start small. I think we all have really big goals. We want to eradicate stigma altogether so that people who suffer from stigma can enjoy full participation in society. But that's obviously a really hard thing to do. So it's good to start with realistic goals and take one step at a time. Last but not least, build better practices. So that pretty much just means that everyone's going to make mistakes, and it's good to document and record and always go into it with a critical mindset so that when you publish an article, when you publish a policy brief, people can read that and learn from you so that they don't make the same mistakes in the future.
Great. So I'm going to be showing some examples that I found in the gray literature, followed up with Skylar showing examples from peer review. So the first example and the first best practice is to put people first. So this is an example of one campaign. I don't know if this is familiar to some people. This is the Stop Serophobia campaign that came from a coalition of community-based organizations in Quebec and was launched in 2009. This came from community discussions about how HIV stigma and serophobia uniquely affected dynamics within Quebec's gay community. We thought it was, and so they represent a video of 2 men that are hooking up. One of them discloses his status to the other one, and the man responds by shoving him back into the closet. So we thought it was important to sort of show examples that reflect the everyday experience of somebody living with HIV and what that could look like, particularly around disclosure and rejection. And I think the metaphor of the closet was a really important one and came up several times when I was looking through the literature.
So Barry Adams and his colleagues published a paper in 2011 evaluating HIVstigma.com, and which is an innovative online anti-stigma, HIV stigma campaign. And they considered the campaign to be a success, primarily because during the planning process, they actually spent about 1.5 years worth of effort to get the community together. So they got people who are suffering from HIV stigma, people who are working in HIV prevention jobs, people from the government, health workers, and all that kind of stuff. And they brought them together to really mobilize the entire community. So it was, the agenda was set by the community for the community.
Thanks. And so the second is to plan for sustainability. So I think this can be a really big challenge sometimes for nonprofit organizations. Like the idea of creating an online campaign seems like it's cheap and easy and free, but most of you know that that's not the case. It takes a lot of work. And we know that a lot of campaigns that we see are sometimes here today and gone tomorrow, and that's because keeping up content is difficult to do. But from a web communications perspective, I think social media kind of helps with some of that in terms of getting people to share content. It keeps it alive in a way, and also I think getting people to participate through sharing, retweeting, posting is a good way to get members of the community to kind of help your message get along. So over here is an example of a campaign from the Stigma Project. I'm sure some of you seen their campaigns online, right? So they're from Los Angeles, and they're sort of a stigma awareness group. And most of their content is online, and so these sort of images, I think, resonate with people.
And so, like what Maggie said, it's really quite a bit of a challenge to ensure sustainability in anti-stigma campaigns. Frankly, because a lot of campaigns continue to frame themselves as campaigns. And borrowing from social movements literature, we know that longevity in mobilized movements or collective action requires renewal and constant renewal. So much of the interventions out there are cross-sectional. So they expose a certain population of people at one specific point of time, and that's it. And so sometimes stigma can be so deeply entrenched that one singular exposure isn't going to do much to change the behaviors. So this paper that I reviewed was written by 2 sociologists who evaluated a course that they taught in the University of Alabama. So there are 2 sociology professors who taught two classes, and the topic was sociology of HIV. And they got them to go into the community and do service-based learning. So they volunteered at homes and HIV hospice. And what they did a pre and post test. They found that there was a reduction in HIV stigma amongst the student population. However, how is this sustainable? Are the students going to modify their behaviors as well in the long run? These are all questions that are not answered.
And the third recommendation that they have is to focus on activities that change behaviors. So often we see this linked to activities like testing or condom use, but I think the medium of talk is another behavior to sort of think about. So we usually talk about social media as a way that we can disseminate content more efficiently and more effectively, but I think anybody who's ever participated in endless threads on Facebook knows that there's a lot of conversation that happens as well. And so what people do with that conversation is entirely up to them, but that potential is there. And I think sometimes we forget it. So over here is a campaign from Speak Out. It's targeted at gay men, and it's part of the Greater Than AIDS initiative. This is from the US and is supported by some groups. This campaign encourages gay men to talk to each other about things like risk reduction, to speak up and ask to be tested, and to talk to each other about how HIV uniquely affects gay men.
So what this one HIV prevention group did in 2010 was that they went to a market and they found individuals who most often and most positively interacted with their peers. And they recruited these community mobilizers and educated them on HIV stigma, HIV education, and then sent them back to the environment to disseminate what they've learned. And so they did a pre and post test as well. They found that there was indeed a reduction in HIV stigma amongst the population, once again. But all that they measured, so this is like the research protocol, they measured changes in perceptions, changes in attitudes, as well as changes in values, but there was no mentioning of actions or direct actions or behavioral changes. So it's really easy, for someone to watch a documentary on climate change and make a claim like, oh, like that sucks, we need to stop this policy, whatever. But at the end of the day, like these people may not, recycle or compost. So attitudinal changes don't always reflect behavioral changes.
So the fourth is to target activities to well-defined groups. And so we're doing this in a way. So this isn't a Stigma campaign, but I just wanted to bring it up as an example of how sometimes good intentions in campaigning can misfire and the complexity of identity. So this sort of backfired. This was an LA campaign that was hoping to get the gay community to take HIV seriously as a community issue. But there were two sort of mistakes that they made is that number one, we're assuming that there's a sort of universal gay identity, and we're sort of not taking account into the fact that people's identities are complex, and being gay is not always the first way people identify, and so you're missing out on a huge segment of your audience if you sort of are too narrow in your approach. But the second one is also quite serious, is that from some of the gray literature that looked at focus groups from ASOs in Toronto, some gay men expressed the sentiment that making messages too focused to gay men sort of reinforced the idea that gay men were somehow responsible and that they were somehow to blame. So we have to be careful about what happens in that sort of transfer from an idea to a message.
So an evaluation of a community health worker intervention to reduce HIV stigma amongst underserved Latinos in America was published this year. And this assessment really drives home the point that in order to create a successful anti-HIV stigma campaign, you have to define your population, and you have to reach out to them and by creating some kind of a cultural resonance with them. So what they did was that they identified some of the more active Latinos in the community. They recruited them, they're all Spanish speaking by the way, and then they send them out to the communities to disseminate this very coherent message. And it was not just any other generic HIV education message, but it was more tied into their Latino cultural identity. So they emphasized on the importance of family, community, respect, and trust. So by focusing on an ethnic sexual group, they managed to leverage cultural resonance, which made the campaign successful. Right, and build better practices. So Although the principles that we shared with you are obviously fantastic frameworks that can guide anti-HIV stigma campaigns, they don't always produce the same results. So the social world is messy, as we all know, which is why we need to constantly evaluate, record, document, and publish what we know so that other groups won't make the same mistakes as we did. So for example, in 2013, a group of scholars published a paper on religion-based HIV stigma reduction. So what they did was pretty cool. They designed two different kinds of programs, one tailored to a religious audience and one that is just a generic one. They went to 4 African-American churches. So 2 of them received the religiously tailored one and 2 didn't. They received the generic one. And after 6 months, they found that there was really no significant differences between their understandings of HIV stigma. So this proves that, number 4, which is what we just said, target activities to well-defined groups don't always work, which is why sharing these evaluations are so important because it really creates a community that is built upon good practices.
Okay, great. Well, we're running out of time, unfortunately, but think big and start small was another practice. And I thought, if we're going to be asking people to make a change, we have to think of a small thing that we can ask individuals to do so that we can ask for a bigger thing that we can all do together. And so I think hashtags are a good way to start that. Sorry, we ran out of time, but I can talk about this later. So I just want to end by thanking the CBRC and our collaborators, the Resist Stigma Youth Advisory Committee, and Public Health Agency of Canada for support. Thank you.